What do you do if you notice a red patch on your skin that looks like this or like this? It might be painful. You might even experience warmth over the area or even a fever. What you do is you want to see a doctor because this could be cellulitis. Let's get into it. Welcome back to another episode. I'm Mike Muellner. I'm an internal medicine doctor from Los Angeles, California, and today we will talk about cellulitis. This is an infection of the skin, but more specifically, deeper layers of the skin, so the dermis and even the subcutaneous fat. Cellulitis usually starts with injury to the skin that allows bacteria to get inside. Common bacteria are Staph aureus or Streptococcus. Any number of things can cause that break in the skin. It could be from a bug bite or even a pimple that causes a little opening in the skin or trauma to the area like stepping on a splinter, a scrape, or a scab. Anything that causes an opening in the skin where bacteria can get inside can cause cellulitis. Usually what happens is it starts with a really small area of redness and pain, which can then expand. Interestingly enough, the way it expands can help your doctor identify what sort of bacteria is likely causing the infection. For example, if it spreads longitudinally, this is more likely Streptococcus, but if it spreads in a circumferential pattern around a central point, oftentimes a pustule in the middle, this is more commonly Staph aureus. And while anybody can get cellulitis, certain conditions increase the risk for it. Diabetes, old age, obesity, these will all make you more prone to getting infections in the skin. Most cases of cellulitis are mild and can heal pretty quickly, but in some cases the infection can spread or it can involve the whole body. We call this sepsis. This is a very serious condition that can even be life-threatening. Now, the treatment for cellulitis involves, you guessed it, antibiotics. And the type of antibiotics we use are really determined by a lot of different factors, such as is the infection bad enough to require hospitalization, in which case we would be likely to use IV antibiotics like vancomycin or ceftriaxone, or if the infection is maybe not too bad, something that we can treat just in clinic or treat with some pills at home, then we might use something like Keflex or Bactrim. In order to monitor response to treatment, it's important to mark the borders of the rash. So all the skin that's red, you want to get a skin marker, or you could even just use a pen, just anything that will mark the borders. That way you can look at the skin from day to day and make sure that the redness recedes from the marked borders. That's how you know that the infection is getting better. If it doesn't, this could be a sign that the antibiotics you're using are not effective. Maybe the bacteria is resistant to these antibiotics, or there could be a deeper infection like an abscess, which could even require surgical drainage. Antibiotics are typically taken for 1 to 2 weeks, and it's important to complete the whole antibiotic course prescribed by your doctor. You don't want to just stop antibiotics when the rash seems to be getting better, because that would be incomplete treatment. You risk breeding resistance among the bacteria, and the infection can get worse. Once the redness goes away, typically you're in the clear. This is an infection that is unlikely to come back. But if you do have risk factors like diabetes, or if you have an immunocompromised state, let's say you've had an organ transplant, you have to take very strong medications to suppress the immune system, you will be at higher risk for getting a recurrent infection, in which case you may need additional courses of antibiotics. And there it is. That's a quick intro into cellulitis, or an infection of the deeper layers of the skin. And while this condition is treatable, you're much better off preventing it in the first place. So anytime you notice any break in the skin, either from a scrape or a bug bite, make sure you keep the area clean with a good antibiotic ointment. If it's a scrape, you want to put a bandage on it. Minimize the risk that bacteria can get inside and cause the infection. I hope this video was helpful. If you enjoyed it, feel free to hit the subscribe button there or check out some of my other videos here. And until next time, I'll see you guys later.